I would only start on the issue of fiscal irresponsibility. Not only do the Republicans know about it, they invented it. We had a surplus the last time the Democrats were in office. So the calling for $2, $4, $8 trillion tax cuts while at the same time saying we got to get rid of the deficit, I will simply leave to you to evaluate whether that will work. So let us think for a bit about the nature of health care. On the Democratic side, I would say all of the candidates have put forward very responsible plans that if you look at the health experts in the United States, we can argue about the details in those plans, and I'm happy to do that. It is a total mischaracterization to say that the Edwards or the Obama or the Clinton plan put the focus on getting everybody covered by a government program. That's not at all what it does. It creates a government option that people could enroll in if they aren't employed, for example, if they can't get private health care, which right now, if you're an individual, you don't have a job, you don't have employer-provided health care, good luck trying to get a policy. I mean, the average policy in the individual market, if you aren't disqualified, is between $5,000 and $10,000. It creates a marketplace where you can choose if you like what you currently have or you want to enter into an exchange and buy private health insurance, you could do that. And there is a public option that you could choose that if you wanted. So I think it's a bit of a bugaboo to say, they're trying to have the government take over the sector. Anybody's got to look at the current situation and acknowledge, and Governor Romney, almost alone among the Republican candidates, has been emphasizing health care, I should say in fairness. The issue of cost saving and getting the price down is unbelievably important and is a multi-year thing. The coverage is an important issue as well and is immediately pressing. The issue of the mandate, if you haven't followed it, is would you put in place a law requiring everyone to buy health insurance? Whether you have a mandate, and the Senator Obama's plan does not start with a mandate. It says let's put all of our focus on getting costs down the most of any of the plans. In the Clinton plan and in the Edwards plan, it does call for a mandate. Every mandate we know in the short run has to have an exemption, and I will say in the case of the Edwards plan, they at least made clear we will have a mandate once health care is affordable, and we will have an exemption for hardship, for financial hardship. Of course, you have to do that. It would be totally immoral to require people to go buy health care they can't afford. I believe it is unfortunate the Clinton campaign has a bit tried to portray their plan as covering everyone immediately, with clearly fudging the issue of what is going to happen for the millions of people who couldn't afford health care now.